Hello everyone, this is Julia. Welcome to my channel. Today I want to share with you how I approach UWorld questions. USMLE question stem can be so long and overwhelming. How am I supposed to finish one question in 60 seconds? If I give you 30 seconds to think and reason through the question, that leaves you 30 seconds to read the whole vignette. It's very obvious that it's nearly impossible if you read it word by word from the first sentence to the last. So skimming is important, but I want to teach you how to do it strategically. It's actually quite simple. The key concept is the order matters. So here I'm gonna teach you 4 steps to help you approach questions more efficiently. Step 1, read the very first sentence. Usually, in the first sentence, they give you the patient's age, gender, underlying disease, symptom duration and onset. These information matters. Usually, you can think of a couple of possible diagnoses based off those information, but you're still not so sure. That's okay. Let's move on to the next step. Step 2, jump to the last sentence. This is where the examiner let you know what they are looking for. The best next step, the greatest risk factor, or the first line, second line treatment. Step 3, skim through the choices and guess what they want to test you on. When you already practice enough amount of questions, you start to get a sense of the potential topic or concept the vignette is pointed at, just by looking at the choices. Based on that information, you already understand the question like 50%, but you want to be more accurate. So here is the step 4. Go back to the middle part of the question step. Now in the middle part, there are a bulk of sentences, lots of information, but always check 3 things. Number 1, vital signs. If the blood pressure is extremely low, you know you're dealing with a shock patient. The same disease with critical vital signs most of the time has different treatment and thus different best next step. Secondly, check abnormal lab data. 95% of the time, those abnormal labs will provide you with some information. After checking vitals and abnormal labs, look for keywords interspersed between physical examination and past history, such as BMI level. If the BMI is prominently high or low, it means something. You can oftentimes lead you to different diagnoses. For example, on obese patients, you might think about OSA, obstructive sleep apnea. BMI less than 18.5, you might think about anorexia nervosa. Lastly, family history, usually not important, might even be misleading sometimes. If in the vignette, they directly point out, let's say the father has pancreatic cancer, the diagnosis of the patient is probably not pancreatic cancer. Exceptions are like MEN1, MEN2, those kind of diseases. They tell you the father has medullary thyroid carcinoma. The patient's diagnosis might be pheochromocytoma. That is the rare case in which family history is important. So you still have to use your judgment, and that judgment comes from doing tons of questions. Now let's do a quick recap. Step 1, read the first sentence. Step 2, jump to the last. Step 3, skim through the choices. Step 4, go back to the middle part of the question stem and look for 3 things: vital signs, abnormal lab data, and keywords. Now I want to give an example on how to apply this strategy. So this is the typical UWorld question. As you can see, the question stem is very long. So let's see how we can use the strategy to approach this question. The first sentence, a 72-year-old woman is brought to the ER because of a 1-month history of progressive shortness of breath and fatigue. So after reading the first sentence, we can guess that this woman probably has heart or lung problems, but we still cannot be sure. So step 2, we jump to the last sentence. Which of the following is the most likely cause of these findings? This is what the examiner is looking for. We now know that we have to find the diagnosis. Step 3, skim through the choices. There are high output heart failure, left ventricular diastolic dysfunction, left ventricular systolic dysfunction, nephrotic syndrome, and valvular heart disease. These choices tell you that it is a heart problem, not a lung problem, and help us narrow down the differential diagnosis. Step 4, go back to the middle part. Number 1, look for vital signs. The vital signs are normal, no low blood pressure. Move on to number 2, abnormal lab data. We see there's only low HB level. We have to keep that in mind because 90% of the time it means something. This low HB level can be and should be explained by the correct answer. Number 3, keywords. This part is a bit tricky because it takes practice for you to grasp the keywords. Here we see jugular venous distension and crackles. It is likely heart failure. Edema is less specific, but we know liver, kidney diseases can also cause edema. But heart failure can definitely have bilateral lower extremities edema as well. And then dark, occult blood, dark stool, and occult blood. So this can explain the low HB level. Based on this information, we now know that this patient is bleeding. Also, images showed enlarged heart and a normal ejection fraction of 70%. Now, looking at the choices, we can eliminate some of them. Nephrotic syndrome, unlikely because it has nothing to do with the active bleeding and heart failure symptoms. Valvular heart disease is also unlikely because if that's the case, there would be findings in the echocardiography, but we only see trace MR. Systolic dysfunction is apparently not the right answer because ejection fraction is normal. Now A and B can be a little tricky, but remember the answer has to perfectly explain the abnormal lab data, which is low HB level in this case. And high output heart failure makes more sense because we know when the body is deoxygenated and the heart will try to compensate the situation and pump out more blood. And eventually the body cannot handle so much blood, so it turns into heart failure. So the correct answer is A, high output heart failure. Alright, that is all I have for today. Thank you for watching. I hope this is helpful. Don't forget to hit the subscribe button down below, and I will see you next time.